Do inlays make your tooth stronger? So if you have a tooth and it has a crack in it, can you put an inlay in there and make the tooth stronger? Or do you need to cover it with a full crown? This is a question we get all the time, especially when we're training our associates. And it's along the lines of biomimetic dentistry, which is minimally invasive dentistry. And so when you think about it without knowing dentistry, you would think that the crown needs to be covering the tooth in order to prevent it from fracturing. But this is why it doesn't. And this is why we can get our teeth to be actually stronger than a crown if done properly without cutting the tooth down to a peg. Because what we do when we cut the tooth down is we damage the pulp a little bit, we weaken the tooth a little bit more, and there's more chances of sensitivity and more issues down the line for the patient and for that. So what this all comes down to is composite shrinkage. So when you bond composite, or when you cure composite, I should say, it shrinks. And this is why fillings, direct fillings, don't strengthen a tooth, but any sort of inlay will. So it can be a composite inlay as well, or it can technically be a layered filling, but that has some other implications that don't fully make it work. It's a composite inlay, a porcelain inlay, or it could even be a zirconia inlay if you're bonding it well enough. It will strengthen the tooth because of the bond. So it needs to be bonded. And what that does is if you have your tooth and it has the break in it, the bond is strong enough that it connects the tooth to its original form. So it's like replacing the enamel. That's how I always describe veneers to patients, right? You've lost some enamel. We're adding some enamel back, right, with porcelain. Just porcelain instead of enamel. So when we put an inlay in there, or an onlay, or a porcelain filling, or a 3/4 crown, whatever you want to call it, we're reattaching all of the lost enamel. So we're recreating the original strength of the tooth. The reason that this doesn't work with composite is because it shrinks. So when we put a large composite in there, even if you're doing it in like 3 layers, the composite shrinks in itself and it shrinks immediately. That's the issue. Because the bond to enamel is very, very strong. But with all chemical bonds, it takes time for that bond to set up. So if you're like if you've got like those command strips that you're sticking on the wall, if you read the label, you're supposed to stick it on the wall, wait 24 hours, and then hang something on it, because that bond needs time to develop. So when you're bonding your fillings or your veneers or whatever it is, the bond forms right away, but it continues to form for the next 48 hours. That's why immediate dentin sealing is so powerful, because it gives you time for that, because it gives it time for that bond to form. And so when we have a thin layer of composite as our cement, right, when we're bonding our restoration, when we have our inlay and we put it in there with cement, there's a very thin layer of composite, and so the shrinkage is very minimal, and so the bond doesn't break. When you have a large amount of composite in there, it shrinks in itself and immediately breaks that bond. If you were somehow to form that bond first and then put the bulk in, right? If you were to do like a 2-step appointment, do a thin layer of flowable in there, cure it, have them come back 2 days later, and then fill up the rest of the composite, then it wouldn't break. That bond would still be there. The tooth would technically bend in a little bit, not bend, but you'd get some tensile forces down at the cervical, but you'd still get a seal and you would still complete that gap from enamel to enamel, which fully strengthens the tooth again. So we'll show you this little video here, which will show you what happens, because you'll see that the composite is now bonded to, and when it's cured, this is a time lapse, it starts to break. The glass starts to break. And so it's pulling in and pulling away. And the research will show that that enamel bond will break at the initial cure if the cement or if the composite, the filling, is too thick. So that's the biggest difference. And you'll also see that it starts to crack over time, right? It's not cracking right when the light goes on it. Thing to remember, because when we cure it, it's initially shrinking. All the shrinkage happens immediately. So it's shrinking immediately. It's pulling away from your margins immediately, and then the bond is forming over time. And so it's this very slight difference in timing that makes it so an indirect filling is needed to restore the strength of the tooth. So theoretically, you could put your filling material in there with glycerin, cure it, pull your filling out. So theoretically, just to help you understand the concept, you could put some glycerin in the tooth so that it doesn't bond, put your filling material in there if you were doing a filling, cure it, take your little filling out, rinse and clean and bond the inside of your filling, your prep, and then you could put that little filling back in there with a thin layer of flowable, and you would get your initial strength back. And so that's the key difference that, at least for me, was one of the factors when I originally got into bio. And that for me at least was one of the key, and that for me at least was one of the nuances that I didn't fully understand at first that made biomimetic dentistry and bonded dentistry much more clear to me, and much more clear on why it works on why it actually works, and why we don't have to cover a tooth fully like we traditionally did before we had bonding, but can still get the original strength of the tooth back. Hopefully that's helpful. And if you want, hopefully that was helpful. And if you want to receive a notification when more of our biomimetic or other clinical or practice management videos come out, hit the subscribe button. And in the description, I'll put a link for our online CE course that goes step by step through all of the procedures and all practice management, if you want an online place where you can fully learn every step of the way and everything that you need to know.